Hi, everybody. The topic today is mold. I mentioned in a previous video that I was interviewing an expert in mold illness. I interviewed her on Tuesday morning. She'll be featured on my upcoming podcast that's going to be released soon. And it was a great conversation. Can't wait to share it with everybody. So I sent out a call for questions and sent a call out a little bit too close to the deadline. So some folks submitted some questions. Thank you so much for doing that. Did not get those responses early enough, and because I put in the call for them for the questions a little bit too late, I think. So I am actually going to be interviewing another mold expert coming up in early November. Her name is Dr. Jill Krista. She's amazing. Those of you who are aware of mold illness or are suffering from it, you may have come across her name. She's quite well known. She's been interviewed on a lot of podcasts before, and she's just awesome, wealth of knowledge. So I'm looking forward to chatting with her soon. However, since these questions were submitted and I know a thing or two about mold illness myself, I thought I'd take a crack at them. So I'm going to answer some of the questions that came in. So one of them is kind of a multi-part question. Just moving my laptop here so I can read it here verbatim. So topics for mold. The first one is weight gain and mold toxicity. I'm going to just kind of rapid fire these because I thought I'd just give a little bit of input on them from my experience. I've had a handful of patients where it wasn't until we started addressing their, just to clarify, nothing I'm saying should be construed as medical advice. This is all for informational purposes only. Please don't make any healthcare decisions for yourself before consulting with your personal medical provider. I've had a handful of patients over the years who have not been able to lose weight until we got their mold toxin levels under control. So that is definitely something that I've seen in my practice, not terribly often, but it is certainly something that can come up. In terms of bloating, I've had several patients to date where their chronic digestive issues did not improve or get over a certain plateau point until we addressed mold toxicity. Mold toxins, the majority of them are excreted through the intestines, and along the way they can really irritate the heck out of that intestinal mucosa. There are also some rare case reports of folks, there are some studies where they've looked at culturing the different things that are growing in the intestinal tract, and they have actually cultured mold out of a couple of intestinal tracts before, suggesting that mold can colonize an intestinal tract in some cases and maybe contribute to digestive symptoms. The next one is about lymphatic swelling or just swelling in ankles and legs, which could be lymphatic swelling. I've definitely seen lymphatic congestion in patients with mold issues. Sometimes it's very visible and there's obvious swelling. Sometimes it's more subtle. There's certain signs or symptoms that suggest that the lymph is stuck or stagnant beyond just swollen lymph nodes. Sometimes that's headache. Sometimes that's sinus congestion. Sometimes it's excessive earwax buildup. Sometimes it's skin lesions, like eczema, things like that, popping up in places like the hands, the feet, around the armpits, these sites where if there's lymph congestion, there can be more stasis around those areas, and when the toxins can't get out the way they're supposed to through the lymph and the circulatory system, they will sometimes come out through the skin, and so definitely seen that before. Question about peat moss. I do seem to recall, I believe that Dr. Krista will be interviewing coming up in a month or so, or just a few weeks actually. I believe she is a big fan of peat moss. I recall her lecturing about that before, but I have not used it myself. I mean, once upon a time in naturopathic school, I remember there were some peat moss baths that we offered out of the student clinic there, but I have not pursued that in practice myself. There's a few other questions here, and I'm just noticing the time running up on the clock. So I'm going to leave it there for now to the individual who asked these questions. I hope this information is helpful for you. I can't promise that I'll be able to ask all these questions of Dr. Krista when I talk to her in a few weeks, but I will do my best to incorporate some of them into the mix. And if anybody has any further questions, or if anybody has any questions on this topic or on anything else, please don't hesitate to post in the comment section below, and I will get to the rest of these questions with my next video. I'll leave it there for now.